Hello, Namaste. My name is Dr. Rekha Rajendrakumar. I'm gynecologist and IVF specialist. I'm practicing in Bangalore, that is Miracle IVF Hospital and Chandana Hospital, Bangalore. I have been practicing for the past 30 years. In my practice, I have come across this PCOS or what we call as PCOD women of all different kinds of age, like they belong to all different age group. Even the girls of the adolescent age come to us, girls of the middle age come to us, those who are trying for pregnancy do come to us, or even certain women who have finished their families also do come to us. So what I want to say is PCOD is such a problem. It encompasses all the age group women. It's not a big issue. You don't have to worry about it as such. It comes along with you, but that does not mean it's a disease. It is just a hormonal imbalance in the body. It's a problem happen at the level of the hormones that are produced at the hypothalamus pituitary level, or what we call as the HPO axis, that is hypothalamo pituitary ovarian axis. There is a disturbance in this orchestra of hormones, and this happens in the woman in the reproductive age group, that is the woman who has achieved menarche, and after that the problems start because they present mainly as the menstrual disturbances, these girls. Now what happens here? I have told that it is a disturbance in the hormone, this understanding between the certain hormones, and that causes the problem. Now, what this woman should do, or what this girl should do, as I have told that it is common in adolescent girls who have not got yet married. So the fertility or the infertility, getting babies is not their problem. Their problem is, one, the menstrual cycles have become very irregular. In the sense, what happens about the menstrual cycle is they're amenorrheic for quite a long time, maybe even 2 months, 3 months. Some people, you may not believe that once in 6 months or only twice a year they have their menstruation. Even it happens so that certain women do get menstruation. Those women who are suffering from PCOS, I mean, they get menstruation only as a withdrawal bleed. In the sense, if you give tablets, they bleed, and otherwise no. But they cannot leave it like that. In the sense, if the woman does not get the period, say 6 months or more than 3 months, she should not think that is fine with me, let me have my periods, why get into all this problem, it's a nuisance, menstruation is a nuisance, etc. No, that's not right. The woman should get her menstruation once in at least 2 months. That girl, she should bleed once in 2 months at least, because the endometrium that gets accumulated inside the uterine cavity, that's not right for it to remain as a long-standing one. When the girl gets aged, say at the age of 50 years or something like that, this endometrium can cause cancer, or what we call as endometrial carcinoma. So that's not right to leave that menstruation like let it happen whenever it should happen. So she should see the doctor and get her menstruation once in at least 2.5 months, if not once in every month. Like even if it's not regular, at least once in 1.5 to 2 months she should get her period. What should she do other than that? She should check her thyroid, because it's another problem. Thyroid is another associated problem. It has nothing to do with PCOS, but the periods can be irregular because of the thyroid problem also, and that has to be ruled out. That's what I mean. So that is also necessary. Coming to the treatment part, the person, whatever age, irrespective of the age, the lifestyle modification is very, very important. In the sense, the woman should take care of her weight. Some girls even weigh more than 30 BMI, and that's a gross obesity. So they should take care of that, because I do have live examples. The girls or the women who come to me, once they reduce their weight, they automatically become much better. Like the cosmetic problems, like their hair growth in the unwanted part of the body, like the thighs, the chest, thorax, or the anterior abdominal wall, all this weight, the hair growth disappears. The acanthosis nigricans, or what we call is that black patch that comes around the neck or the different body folds, all this, and even the pimples, or what we call as the acne, etc., all these are going to vanish once the weight reduces. So especially the adolescent girls, they are so much worried about the cosmetic part of their the appearance they are worried about. So once they reduce their weight, it's a multi pronged advantage, in the sense, one, because of the weight reduction, their periods become regular, because the hormones come back to track, and so the periods become regular, one. Then second thing is their pimples, the acanthosis nigricans, that black patch what I was mentioning before, or their the abnormal hair growth in the body, all these things disappear and they feel much better. So the lifestyle modification includes weight reduction, that's one. And the second thing, sometimes they may need the help of some drugs. Weight reduction is one is by the diet part, that is they have to take care of their diet, in the sense they have to concentrate so much on not taking much of carbohydrate. It should be a more of protein rich diet with added more of antioxidant like fruits, vegetables, etc. So the woman is supposed to take that kind of food. And other than that, the exercise is also important, because the building muscle is also equally important, because PCOS is also a condition where we call it as a metabolic syndrome, in the sense there is chance of hyperglycemia in these women, that is an increased blood sugar. There's a chance of hyperinsulinemia, which is a compensatory phenomenon to hyperglycememia. To reduce the blood sugar, the insulin secreted from the pancreas also increases, and that's called as hyperinsulinemia. They also have the increased chance of increased cholesterol in the body, or what we call as a hypercholesterolemia, increased incidence of coronary artery disease, etc. So this all put together in a package is called as a metabolic syndrome. So the weight reduction not only takes care of their appearance, other than that their lifestyle modification will take care of the metabolic syndrome also. Other than that, sometimes they may have to take certain measures to get that unwanted hair removed from the body, etc. And sometimes we have to take administer certain drugs to them, in the sense for their menorrhagia, where the menstruation does not stop even after say 2 weeks. That's a heavy menstrual flow, or they're not got the periods on time, like we have to give the withdrawal bleeding kind of tablets like progesterone, that's a medroxyprogesterone we have to give them, or sometimes even the oral contraceptive pills we have to put the woman on, where it's a combination of ethinyl estradiol and the progesterone. So these are all the drugs we give in the adolescent girls or the women who are not in the reproductive age group bracket. But there are certain women who do come to us with infertility also. PCOD is one of the very important causes. It's almost a 90% reason for the ovulatory infertility. Like the woman is otherwise fine, the male factor is fine, the husband is normal, the tubes of the woman are fine, the uterus is quite normal, there is no problem, but she is not conceiving because she is not able to produce these eggs, the quality eggs, on time. These kind of women are rich in eggs, like the antral follicle count is quite normal, it's quite high, rather it's on the higher side, but these eggs are not quite normal, in the sense the development of these eggs are quite not okay. They're either they suddenly shoot up, or sometimes it's a very resistant kind of ovaries, where how much ever drugs, whether you give the oral ovulogens or the like the clomiphene citrate or letrozole, it does not help, and sometimes we may have to go to gonadotrophins, and certain times in spite of gonadotrophins that just don't respond, and these are called as resistant ovaries. So in these kind of women, we may have to take them for a longer protocol with longer oral ovulogens, or a small dose of long course of gonadotrophins, and then take them for IUI, that's intrauterine insemination, or sometimes we may even have to shift them for IVF. When we do IVF, we have to be very, very careful in these women, because they are highly prone for what is called as OHSS, that is ovarian hyperstimulation syndrome. So we have to take care of that with certain measures, which I don't think I have to explain here. In summary, what I want to say is, like, it is not a disease, it's just little disturbance, endocrine disturbance, misunderstanding between the hormones, which can be very much corrected by the person herself. She can take care of herself and also take help of doctors like me, who are more than willing to help help these kind of women. Yeah, thank you, and good luck to you all.